And this is the Health Law News Nugget for the week of April 13th. Well, happy Easter to those of you who celebrate out in News Nugget land, and thank you so much for watching today. We haven't had a News Nugget in about a month, ever since the coronavirus hit and started affecting states and ultimately the federal government in the past 30 days. It's been wild here at Southern Health Lawyers as we're trying to digest the Families First Coronavirus Response Act, the CARES Act, and the PPP loans that everyone's been consumed with, as well as trying to make sense of the various levels of telemedicine waivers and even a stark blanket waiver. That's a brief summary of what's going on the last 4 weeks, but I wanted to record today's News Nugget and get back to a weekly schedule for News Nugget viewers to talk about an interesting development in constitutional law. So the White House, during the course of the COVID-19 epidemic, the White House has taken to almost daily, and I think practically every day, a press conference where the administration officials are basically updating the public on the status of affairs with regard to the outbreak and all the various public health issues that arise over the course of the day around the nation. Monday was significant. This past Monday was significant. The press conference featured a couple of questions from reporters who asked President Trump what his opinion would be on getting back to normal, kind of business as usual. And various outlets are reporting on Tuesday that the president said, originally the goal was to be back to normal by Easter, but I think most folks realized, and probably even the president realized in hindsight, that that was a little too aggressive and optimistic. But now the projection is that, especially in states like Georgia, which is going to be hitting the peak this weekend, and other states that have hopefully already hit their peak, like New York, that we may be able to get back to business as soon as the first week of May. The question was, well, what about, Mr. President, if we have states that aren't on that fast track? What will you do as a result if a governor that has an emergency order in place disagrees with you? It's very interesting and causing a lot of, discussion amongst constitutional law experts, professors and the like, because the president basically said, well, I'm the highest authority when it comes to these kinds of issues, and as the President of the United States, I have the power under the National Emergency Act and the power to say that we're out of an emergency. And so if I disagree with a governor of a particular state on the timetable for return, then basically federal authority rules. It's a very interesting concept of federalism that's built into our Constitution for over 200 years, that the federal government has certain specified powers and the rest are left to the states. But there's always these gray areas, and it feels like return to normal as a result of the COVID outbreak could be one of those, where we have a gray area between the federal government that's looking to have a robust return and a state government that may be saying we're not quite ready yet. So stay tuned. We'll be able to feature that in coming discussions in April, and hope that you're all safe and well this spring. I'm Rich Sanders with Southern Health Lawyers. Thanks for joining us today. We'll look forward to talking with you soon.